2 minutes in, perhaps I'll start and introduce our speakers so that we give them as much time as possible. And I'll introduce them in a little bit of a different way, since the email, I don't know if I can compare to just how rich that the email invite was, talking about Charlie Wiles and Ann Cottingham. But Charlie Wiles is the executive director for the Center for Interfaith Cooperation in Indianapolis. And I had the pleasure of meeting him virtually in, gosh, was it the first year of the pandemic, as Mona and I were putting together the Religion and Spirituality Medicine Scholarly Concentration. And I'm so grateful Jay introduced us, and I began to learn about your work. And then we got to meet in person more recently when Jay and I were visiting Mojid Al-Far with you and seeing the work that you're doing there. And so Charlie is going to be our first speaker, talking about religious diversity in Indianapolis. And then our second speaker is Ann Cottingham, who I met when I was in my pediatric oncology / clinical ethics fellowship, just beginning to learn about spirituality research. And I remember we were in New Orleans at the Caring for the Human Spirit conference, the chaplaincy conference, and Ann Cottingham was led a session on how to do qualitative research. And of course, she is part of our Evans Center, as well as the Director of Research in Health Professions, Practice and Education at the Center for Health Services Research at Reagan Street Institute. So I'm going to give the floor to first Charlie and then to Ann. If you will save your questions, you can either put them in the chat and we'll answer them one by one at the end, or even just write them down, and then we can have a time of conversation and dialogue at the end. But first, Charlie Wiles.
Thank you very much, Dr. Lyon, and thank you, Gloria Robertson, for it's a real honor to be part of this colloquium today, and it's a real pleasure to work with Ann Cottingham. We've worked before, and I look forward to learning a lot from her research and her presentation. And full disclosure, I have worked with Jay Foster and Shadrach Comwindo on the Congregational Care Network, and really looking at our faith communities as a vehicle to extend good physical, mental health resources and to lower the barriers of access. So as Dr. Lyon said, I'm the executive director of the Center for Interfaith Cooperation, and I thought just a quick approach, and I apologize, some of you have probably seen this slideshow presentation. I just wanted to give a brief overview and use a few slides to talk about our work at Center for Interfaith Cooperation, and then I'll get more specific. Something more germane to this audience is we've done some religious diversity training, and we went out into the congregations. Alex mentioned we were at Masjid Al-Fajr, and we went to 5 other houses of worship, and I'll talk more specifically about that and wrap it up in less than 15 minutes, and hopefully we'll get into some robust questions. But first, let me share my screen here. There, I hope everybody can see that. So again, exciting to be here today. Can everyone see that fine? Good. So the mission of Center for Interfaith Cooperation is to create environments where the community can come together. Our goals for every program that we endeavor is to increase religious literacy with the group that we meet with, to help build empathy between and among the faith traditions, and to facilitate interfaith encounters. So that's our goal. We're located in the Indiana Interchurch Center, wonderful building on the corner of 42nd and Michigan Road. Built in the 1960s, 4 mainstream Protestant denominations came together to build a physical space to do ecumenical work. And of course, our demographics in Indianapolis have changed dramatically since the 60s. So our organization brings together a variety of different faith traditions. We try to use outreach to youth. We have a business plan that we've put together, and a big focus is working specifically with youth to keep our mission relevant and vibrant. This is the latest post-COVID picture of our board of directors, the last time we met in November. Our board of directors is at this point 27 people. We've had up to 40. It represents 9 different faith traditions, all that call Central Indiana their home. The one thing that we do well, I want to differentiate our interfaith approach from some of the others. So many good interfaith groups in Indianapolis and Central Indiana. A lot focus on the environment. Some focus on home insecurity, food insecurity. Faith in Indiana focuses on a lot of wonderful social justice topics. Ours is really about building relationship across difference. As you would imagine, we don't agree on a lot of things, and that's why we have the organization, and that's why we try to build that trusted relationship to better understand those differences. The one thing we all stand up is if any faith group is attacked, and this is an example of a press conference when there was a very negative sign towards the Muslim community that was actually paid for by an out-of-state group that was put up on 465. Very quickly, we had folks from 6 different faith groups that came and spoke out against that sign. A lot of you might remember Shari Tefillah, a beautiful synagogue up on 116th Street that was vandalized. We worked with the Jewish Community Relations Council, and within 36 hours, we had 7 different folks from different faiths speak out against that terrible incident. And we invited people to the synagogue. We worked with the leadership at Shari Tefillah. They were expecting a few hundred people. We had well over 1,000 people who showed up in less than 48 hours to show their solidarity and their disgust in the vandalism. And a similar thing happened to a Hindu-owned business. They were vandalized and their dumpster was set ablaze. So we stand up very quickly when any one of our faith groups is attacked. I would say that one thing that we all stand together on is the solidarity behind a healthy pluralistic society that allows people to pray and worship as they choose or not. And that's something we stand very strongly behind. A big part of our outreach is working with an AmeriCorps program. It's a national community service. This is a post-COVID group. We've had a group every year for the past 10 years. And a lot of their focus is working in the faith communities to extend the capacity to provide mental health resources, to connect with any type of physical mental health, lower the barriers of access to that. And that's where we work a lot with the Congregational Care Network with Jay and Shadrach. We have 2 signature events every year. A big one is Festival of Faiths. We're going to do it again this year in person, God willing, and the creek don't rise. We'll be downtown in Veterans Memorial Plaza, and we usually get between 60 and 80 booths representing, again, the beautiful religious diversity. We have a sacred art stage. We share food. It's just a really fun, family-friendly celebration of our religious diversity, and we'd like to do it downtown. It'll be September 18th, and hopefully you'll get some information about that if you want to join us. We start with the big procession of faiths, and it's just wonderful and for me, very inspiring to bring our different faith groups together and show our solidarity. We start in a good Jewish tradition. We blow a shofar to get the procession started, and it's really a lot of fun. And this is a representative, a woman from Indianapolis Hebrew congregation blowing a shofar to start the festival several years ago. As you can imagine, the beauty that the faith traditions bring to our community, and this is just a representative of some young folks from the Hindu community. This is some of the beautiful Celtic tradition. This is one of the booths that you might see. This is the Sikh booth. They'll tie a turban on your head. I'm sure they'll do it again this year. If you ever wanted to wear a turban, come down to the Festival of Faiths. It'll be your opportunity. Another of our signature events is called the Interfaith Banquet. We try to recognize someone in the community who's done kind of extraordinary work to reach out and connect faith communities. The first year it was Don Kniebel, wonderful guy. He's our founding board director. KP Singh, many of you probably know him. If not, you've seen his artwork. He's all over our public buildings, but KP is a wonderful representative from the Sikh community. Sister Norma Rockledge, unfortunately passed a couple years ago, but Sister was the president of Marian College at the time, Marian University now, but wonderful woman, did wonderful interfaith work. Rabbi Dennis and Rabbi Sandy Sasso, wonderful leaders of Congregation Beth El Zedek, were the interfaith ambassadors one year. Imam Mikhail Sahir runs a small Islamic center, Nurallah Islamic Center, 39-year veteran of the police department, the fire department, along with his role as being a local imam. Betty Brandt is with St. Luke United Methodist Church, does something called the Spiritual Oneness Center, and really opens the doors of St. Luke's to all different faith groups, and she's been doing that for decades. The mayor always comes to our events, loves them. A lot of you, he has a degree actually from Christian Theological Seminary. A lot of folks don't know that, but if you've ever, sometimes he gets to preaching. And Mayor Hawks, that's been a wonderful advocate for interfaith work. During COVID, we decided to honor an organization, so we honored Ascension St. Vincent and their work. Ascension as a national organization is aspiring to something called ABIDE, and that's an acronym that calls appreciation, belongingness, inclusivity, diversity, and equity. So we honor them for that effort, and we work with them, and I'm going to talk a little bit about a program we did with them that I think, again, will help inform this conversation. And last year, we were in person again. We were at Union Station, and we honored Dr. Vimal Patel, and he actually was Associate Professor of Neuropathy from Indiana University School of Medicine, and he served as the Director of Neurochemistry Diagnostic Laboratory in the Department of Pathology for 34 years. And he's also an expert on Ayurvedic medicine, which is a fascinating study if you've looked into that. This year also with our banquet, we started a big focus, as I mentioned, is on youth. So we picked 2 youth interfaith ambassadors, Iman Mirzra and Trace Held, and they were at Park Tudor, and they started an interfaith group at Park Tudor and had over 50 students involved in visiting different houses of worship here in Indianapolis. And we partnered with them on a couple of wonderful programs. Iman is now at Harvard, and Trace is at the IU Kelley School of Business. I saw that Reverend Gill was on this colloquium, and I've worked with her at St. John's Missionary Baptist Church for the past several years. We do a Martin Luther King celebration. They've been doing it for 50 years since Dr. King was assassinated, and we joined them about 6 years ago. And what we do is bring interfaith voices to the celebration of Dr. Martin Luther King and the legacy he's had on our country. And what we do is we recruit people from different faith communities to share something about their faith tradition that aligns with the mission and values that are represented by Dr. King. And it's been a lot of fun, and it really shows the value over time of working with communities and kind of imbuing an interfaith spirit on some longstanding events. The other thing we do is youth dialogues. We have representatives from different congregations. They invite other youth to visit. Here we are at Indianapolis Hebrew Congregation, and the young man there, we're looking at a Torah. It was a wonderful experience with youth. Here we are at the Hindu Temple of Central Indiana. Here we are at Mount Zion Baptist Church off of Boulevard. These are the young people that were involved in that. We give them a certificate every year to really encourage their leadership and continue to be interfaith ambassadors for the rest of their careers. So what I think is most specific to this conversation, and what I'll spend the last 6 minutes talking about, is a religious diversity training we did with employees at Ascension St. Vincent. I think what was most fascinating about that, and I'll stop sharing my screen now. I think what was most fascinating about that tour was that we first of all, it was cross-disciplinary. So we had doctors that were involved we had a cohort of about 20 people that included doctors, nurses, we had mental health professionals, we had chaplains, and we did have one pharmacist. And what we did is we visited the 6 different houses of worship. It started at St. John's Missionary Baptist Church. Thank you to the good graces of Reverend Gill. When we went to each of the houses of worship, we got a brief tour, learned a little bit about the congregation and the demographic that they represent. And then we had a medical professional, a physician, I think, in each case, talk a little bit about how faith has informed their medical practice. So Dr. Latasha Hayes, actually, she's an IU health physician, spoke about her journey as an African-American woman and a doctor here in Indianapolis and how her Baptist faith informed her medical practice. Then we went to the Sikh Gurdwara out on the south side. We listened to Dr. Sukhwinder Singh, who's also a member of IU Health, and he spoke again how his Sikh practice, how his Sikh religion informed his practice. From there, we went to the Hindu Temple of Central Indiana, heard from Dr. Anita Joshi. As Dr. Lyon mentioned, we went to Masjid al-Fajr, and we heard from Dr. Seltaji, who's a member of Riverview Health. It was fascinating to be there and to learn about how his Muslim faith, he was actually educated at the University of Syria in Damascus. That's where his degree came from, but now he's the director of emergency care at Riverview Health. And we finished at St. Monica Catholic Church and listened to Dr. David Stuhldreher. Oh, I'm sorry, we also went to Beth-El Zedek, and actually Dr. Alan Berkowitz talked about his medical practice and how his Jewish faith informed that. So it was fascinating. It was really fascinating to hear from each of these medical professionals within the context, within their own houses of worship. I just felt like that was such a much more powerful message. I know it was as a participant, the members of the cohort all reflected that. And I think it was also for the people who were presenting, just an opportunity for them to speak about their faith and how that built the foundation for how they deliver and practice medicine. The one thing that we measured along with the 3 goals the CIC has in mind, we increased religious literacy. I think we got 100% on that. We built empathy for people from different faith backgrounds. 100% of the participants agreed that they did help build their empathy. And we encouraged more conversations about faith in their personal, professional lives. But the other thing that we measured was a national test on cultural agility. And basically just how agile do you think you are in a multicultural environment? And people, it was a self-assessment. We did a pre-test and a post-test. I think the fascinating kind of counterintuitive result we got was a lot of people rated themselves lower after they had visited the 6 houses of worship than before. And the way we're kind of internalizing that result is that people became more aware of what they didn't know. Maybe they had these assumptions that they knew what it might be like to be a Muslim or a Sikh or a Hindu going into a medical or clinical environment. And maybe they kind of reassess their own skill set. But I think that's probably a good thing. It builds a foundation to grow from, and hopefully it inspired a lot of intellectual curiosity. In fact, one thing that emerged from that, and something that I hope might come up in conversation, is the idea of empathetic curiosity. And I know that is an interesting term that people are using now, and it could be a wonderful thing to measure to help try to understand the quality between a patient-client relationship, particularly when it comes to medicine, is to have that empathetic curiosity of how, when I think about the clinical setting, and I looked at the Dan Evans website, so many things that you want to do to promote spiritual well-being and the whole person care within the IU health system. So how do we do that, and how do we measure that? I think when we're in a clinical setting, I mean, what's the aesthetic? What symbols do people see? What pictures are on the wall? What kind of food options are available? How do you accommodate a family member to help in the care of the person who's being treated? It's so profound to be in these spaces, and I've been in them. I can describe the room at Methodist Hospital where my first daughter was born. I mean, that's a gateway to life, right? We enter life through a hospital, and if we're fortunate, we have good quality care, and we exit life through a good medical institution. And I think we can describe it as intimate spaces. And how could we increase the spiritual well-being? One thing Ascension aspires to, and when I read through the goals of the Dan Evans Center, IU Health obviously aspires to too, is to really address not just the physical needs of any client, but the spiritual and the mental needs of a client. And I feel like when we focus on the spiritual, we can certainly have a very positive impact. I thought of a couple of different quick ideas, and I'll end with these. If we did like an inventory, a spiritual inventory of some of these clinical settings and the clinical relationships, is there good food available? Is there vegetarian food? Are there halal options? Are there kosher options? Are people aware of those when they're in the hospital? Are there prayer rugs or private spaces for the patient and family members to be able to pray together or have that meditation moment? There could be innovative ideas like podcasts, or there could be video messages from prominent faith leaders that people could see on the video screens of the televisions while they're in the hospital to help increase that spiritual vitality and hopefully have good impact on the mental and physical health of the patients. And then just accommodating families to be very much actively engaged as caregivers, because obviously they'll go back to the home and there will be primary caregivers. So those are just a few of the ideas that really were inspired by that conversation. And again, I thank you very much for this time. Look forward to sharing ideas, and I look forward to hearing from Ann Cottingham too in the next one. So thank you.
Thank you so much, Charlie. Look forward to hearing more after in our conversation time. But next we wanted to give some time for Anne to talk about her work and share what she's been about.
I was muted. Thank you. I'm delighted to be here and share with you a little bit about the work that we've been doing the past few years. The work I'm going to describe today started as an interest on the part of IU Health to get to know the spiritual communities, initially kind of around Methodist Hospital, but then across Indiana in a little more collaborative way. They wanted to reach out to the spiritual communities and learn about what they considered to be important in terms of their own characteristics, their own community, and the community within which they were located. They wanted to know more about their interest in healthcare and how their spiritual perspective might inform the way members of their community would understand their own health and decisions that they might want to make if they were hospitalized. And they wanted to get a better sense of what is important to that community and how IU Health could be useful. So we interviewed about 30 spiritual leaders and we audio recorded all of the interviews. We did an analysis of the themes that we developed from those interviews. And the number one request on the part of the spiritual leaders was to expand the knowledge of IU Health clinicians about the best ways to provide appropriate and respectful care for individuals from a variety of spiritual traditions. And so based on that,
The last words I heard were based on that. Although your video is freezing as well.
I think she may have frozen up, yeah.
I have found if you turn off the video, sometimes the audio comes through stronger, but I'm not sure.
And you're muted now.
muted, unmuted. Are we good?
We're good.
All right. So I partnered with the Evans Center, with IU Health, Spiritual Care and Chaplaincy Care, and particularly with Rabbi Bruce Pfeffer, who's here today, to think about how we could respond to that need. So I worked closely with Bruce to put together a panel of Jewish rabbis to talk with them a little bit about, what might be important, what kinds of information we might want to share with clinicians at IU Health. And we ended up putting together a panel presentation that we provided at IU Health North with a lunch in person on a Wednesday afternoon. And it was incredible. I think we had 35 participants, very high energy, lots of questions, lots of learning, and quickly decided that this seemed to be very useful to the clinicians and that our spiritual leader partners appreciated it as well. So we decided to continue on. And I'll just briefly share my screen and show you. See this okay? So this evolved into our Conversations on Spirituality, Faith, and Health series that we present approximately quarterly. And so since that time, we have been carefully cultivating and identifying spiritual leaders who may have an interest in partnering in this work and putting together a panel presentation in close collaboration with these leaders around their traditions. So the goal is to allow our IU Health clinicians to better understand the background of a tradition, the lifestyles of individuals within that tradition, and then of course, particular spiritual beliefs that might influence how that patient would like to be cared for if they were hospitalized or when they're receiving care from an IU Health clinician. And so I'll show you just briefly a few of the communities that have been involved to date. We started, as I mentioned, with about 35 participants. Now that we're able to do this via Zoom, we've had upwards of 200 participants at some of these events, and I think they've been very well received. The panel really directs the content that they would like to share. We, as I mentioned, asked them to talk in about 3 or 4 categories. If there's differences of opinion between maybe more conservative or more liberal individuals in the community, we asked for representation from that spectrum, as well as ideally male and female participants. And everyone has been very willing to do that, and quite frankly, thrilled at the opportunity to share information about their tradition with our clinicians. And so this is something we are going to continue. And I think based on the feedback that we have received to date, has been very informative, and I think very important for clinicians who may not have known in much detail about some of these traditions or about some of the preferences individuals in these traditions might have for health care, for interactions with clinical staff or physicians, and the kinds of support they might like if they're hospitalized or receiving care. So all of these things have been discussed in a very open and casual way. Our participants, I think, have felt very free to ask questions. So this is a series that we're really excited about and plan to continue into the future. It's open to individuals who are interested in doing this. If you or anyone you know would like to, get a panel together and share some information about your spiritual community and related to healthcare and how it would be best to care for patients in your community, we would invite you to contact me and have a conversation. So that is all I have right now. I'd be open to questions.
Yeah, and in this time, we'll just open this time for conversation, both between Charlie and Ann, as well as anyone who has questions for them. Feel free to unmute and ask questions freely.
And Bruce Pfeffer may have additional perspectives on this, as he worked closely with me to get this off the ground.
Just thank you. It was a great experience, and I actually enjoyed helping pull the panel together for the Jewish perspective.
I may start with a question, if I may. I'm happy to see Chaplain Marilyn Gill with us, and she was the first person that I reached out to get a tour of St. John's Missionary Baptist Church, and I just wondered what it was like having a cohort of medical professionals visit St. John's, and your impressions of listening to Dr. Latasha Hayes when she spoke.
You're on mute.
Thank you, Charlie. I found Dr. Hayes to be quite impressive. And I think what stood out more to me was how her faith impacted her work, as though it was a simultaneous endeavor and not something separate. Prayer, faith meant a lot to her in dealing with her patients and in her work. I felt that the chaplains and the doctors that were there, the nurses, were very impressed with Dr. Hayes and with the history of St. John's as well. It was definitely an endeavor that was worth projecting out, and I think we should have more of those.
Charlie, a question maybe feeding off of that is that cohort of 20 that came to the different houses of worship. How did that cohort come together, or how did that invitation go out?
Well, we've been working with Ascension St. Vincent on a couple of different projects. I'm on their chaplaincy advisory board. I've been on that board for past 6 years, and they've had a real express goal to attract more diverse voices to help inform a whole variety of ways they're improving chaplaincy, but also just their basic healthcare. Like I said, St. Vincent is focused on, they say, the mental, physical, and spiritual needs of every person who walks in their doors. And I know after IU Health is similar in that regard. So they suggested that the value of actually going out and meeting, I think, as Ann pointed to, the more informed all the different folks that are involved in the care of a patient are aware of the unique specific spiritual needs or not. I think that's kind of a very fundamental question. Is the person interested in sharing and being involved in a discussion about their spiritual dimension of their healing process? So in any case, we spoke with it was actually the chief medical officer over there, Dr. Jeff Rothenberg, who's just hugely interested, and he was mostly interested in having his physician residents have exposure to the religious diversity in Central Indiana, knowing that many of them have not had experience to meet folks from different faith backgrounds. So he was the real instigator. We sat down with Dr. Berkovitz and another gentleman and kind of designed the training and decided we model it after what CIC does on a regular basis, which we call sacred spaces tours, where we just simply open the doors to different religious sites, allow the general public to come, and usually a clergy or docent leads the discussion about the faith community. But in this case, I think the real value added is we heard from a medical practitioner from each of the congregations we visited. So each congregation had in each case, it happened to be a doctor. So a physician spoke about, and like Reverend Gill said, Dr. Latasha Hayes was just so informed. She said God was with every decision that she made, even deciding to be a doctor, going through medical school, and now in her medical practice. And I felt we heard similarly from every one of our respondents. So that's how that came about. Dr. Lyon, I hope that answers the question, but it was the curiosity and the desire for St. Vincent, particularly as a training facility with the resident physicians, to have exposure to the religious diversity that's here in Central Indiana.
Hey, Alex, I have a question. It's Marcos.
Go for it.
Thank you, Charlie and Anne, for your presentation. My name is Marcos Collado. I'm the manager of spiritual care and chaplaincy services at Riley. And my question kind of revolves around, how do you make a business case for expanding religious interfaith literacy and inclusivity in the hospital? I can make the appeal to the values of the organization, but I, recently was in a meeting in which they were spelling out the deficits in the budget. Operations and labor has gone up due to some financial decisions that the organization has made, which rightfully so. For instance, they bumped up the minimum wage of some workers from 15, I believe, to like 16 or 17. So these are good, equitable financial moves and decisions that the organization has made, but nonetheless, it does cut into what they forecasted for budgets. So I guess kind of a long-winded way of saying, how do you translate this into, and I hate to kind of reduce it to the bottom line, but how do you make the business argument for administrators about the benefits of moving in this direction of increasing our interfaith religious literacy and education.
I think that's a great question. I'm happy to take it first. I'd be very interested to hear from Ann and from Jay or some other folks that are in the quote unquote business. I think it's, speaking in business language, I think it's competitive edge, right? If we can empirically prove that the quality of the experience of the patient is enhanced by trying to address, and I talk about the spiritual aesthetic, right? When someone comes into a facility, do they feel like their spiritual needs are being, first of all, respected, honored, and accommodated? I think that would be a competitive edge. Now, I don't know the empirical data, but I'm assuming that folks whose spiritual needs are being recognized will report of having a higher quality of care provided for them by the institution had they gone through that. And I also feel like it can be empirically proven. I know I just went through this with my father, who had a heart procedure done and actually ended up in the hospital for over a week. I think the spiritual care was critical for him to overcome what could have just been depression or lack of will to want to overcome the obstacles. I mean, the indignity of having to be cared for, 24/7. So I feel like it's I don't know. I love your question, but I think you could argue it from a competitive edge in providing healthcare. But I'm curious to hear from Ann and possibly Jay or Shadrach if they want to weigh in on that.
I would completely agree. In our sessions, we've had panelists share there are certain hospitals they won't go to because they know they will not receive the care in the way that they prefer. They know that the practices are not practices that support their spirituality. So I think your point is very well taken. I think also in terms of demand, I mean, having 250 clinicians join us for a 2-hour event, and they stay on the entire 2 hours, I think helps also speak to the need so many clinicians feel to have this information and their desire to have this information. We know that many don't receive training in this area. I think most, based on multiple studies. And so this is probably, the only training that they're getting in how to care for patients from different spiritual traditions. And I think that we know by the numbers that are attending, they think it's important. So I think you could approach this from multiple strategies.
Yeah, I'm glad, Marcos, for the question. Excellent question, and glad you're attending those meetings for us at Riley and representing us so well. Two thoughts in support of what both Charlie and Ann said. Team member engagement goes up, and it really supplements exactly what Ann was saying. But team member engagement goes up when they feel. When a team member feels competent to and encouraged to care for themselves and for the spirit of their patient. So I think that if we give some people some tools and permission to care for the spiritual needs of their patients, that's going to increase a team member's sense of purpose and mission and increase their sense of wanting to stay with the organization, which is in itself a huge bottom line factor. The other thing I'd say to this group that I'm not sure I'd say to an administrator, I'd have to think about it, but I'd say it to this group, is that we live in a time when religious people are mean to each other in the public sphere. And that kind of meanness shows up at the bedside between providers and patients and between family members with each other. And so the capacity of the chaplain and other team members to care for themselves effectively and to intervene a little more effectively when needed with patients when there's that kind of challenge is hugely important. And so giving people some vocabulary to talk about those things and some competence to talk about those things is a really tough job, but very important. So I'm excited about this conversation today. I don't know if people would, I see some heads nodding, but lots of people's screens are off. But I certainly think we're living in a kind of mean time, and we need a lot more meetings like this one when there's a lot more love.
Thank you all.
To your point, Jay, and conversely, at the heart hospital, I was just recently my father just went through a kind of a big threat. When you go into the elevators in this heart hospital, there was a huge sign saying foul, abusive, and intolerant language will not be tolerated in this facility. Isn't it a shame we're in a state where within a healing institution, within a heart hospital, that type of a sign needs to be presented so people coming and going will be put on alert that they can't use foul and intolerant language? I mean, we are I would say the rise in mental health too is a huge case for needing to address spiritual needs. Now, how we do it is the critical question. Again, how do we create that aesthetic that accommodates folks where they're at, not necessarily where we think they should be, but to be able to engage people in that's where I think the empathetic curiosity is probably some language we'll try to grow into.
What other questions do we have for Charlie and Ann? Other thoughts?
It dawns on me to ask Charlie and Anna, as you've been thinking about this, we're trying to figure out how to scale these kinds of conversations at a really large level. How do you, as you've thought about the work you're doing, have you thought about how do you keep how do you achieve the value of good and clear conversation and also try to move it? 35,000 IU Health team members wanted around here. How do you scale it?
Happy to jump in first again here. And part of it is that partnership. I think the community, not-for-profit or faith-based, I see the more work I do learning about, visiting, and becoming just much more familiar with our religious diversity in the different houses of worship. It is such a central location for so many folks, particularly in the minority religions or immigrants and refugees. It's their trusted, safe space. So the more that we can extend good preemptive care or good healthcare information, good mental health resources. And I know we partner with NAMI, National Alliance for Mental Illness. So I think the more that we can look at our community, and particularly the faith community, as an infrastructure to help extend and lower barriers of access, I think that's very scalable. And I know, Jay, you came over here to support the Memphis model, which had, you said, upwards of 600 congregations that were actually involved in helping increase the mental and physical wellness of the community. So I think when we're looked at each other as engaged partners, as we're connected, to me, that's the scalable element, is looking at the entire community and the infrastructure to be able to extend access to good preemptive healthcare benefits all of us.
I completely agree. We heard a lot about that in terms of our interviews in that study and a current study on COVID and faith leaders now. There was a great desire for IU Health to partner with these communities around mental health, which was a huge issue, one of their top concerns, an area that many spiritual leaders were not comfortable dealing with, but weren't sure where to refer. But now with COVID and other kinds of illness that might become prevalent, there's a great need for information that's trusted. And so we had lots of requests from spiritual leaders for IU Health to partner with them and just coming in and talking and sharing scientifically based information that members of their community would trust. And so I think there are lots of opportunities and a great need for this kind of partnership.
One of the things that comes to my mind is the picture of a radiation seed, of the seed radiating. And so many people, I think, are hungry for peace and peacemaking. And I'm interested to hear what you believe will be the impact on society for there to be these conversations within healthcare, and maybe even to think about what is the future of, is this a new conversation, or is it something that is just new in our time, to think about interfaith in healthcare, and where do you see that going in society?
That's a light question, Doctor. So to see how you would approach that, I love Cesar Chavez quote. It starts in our heart and it radiates out. So that when you mentioned the seed, I think of that quote from Cesar Chavez. I think, maybe going back to what Jay pointed to, how public rhetoric, public discourse has become so crass, right? And people feel empowered to say things that, that decorum would have prohibited, even a couple of years ago, right? So I think the healing arts, and when we think of them of the healing arts, and when we think of the healing process as a sacred process, and it's necessary, again, even if I hate the bifurcation of believers and non-believers, right? Because I think when we're in a vulnerable space, we're all believers, right? That we need help and that we're seeking that healing, even if, whether that comes through pure science or through, science and spirituality. I think still that positive mental attitude and the impact that can have. So, I grew up in the 70s. I grew up when the moral majority came about, and some of this, what I consider kind of a toxic mix with politics and religion came about. And I know it turned off me and a lot of my friends. We were just like, well, that doesn't represent me as a Christian. And I just, I'm not part of that moral majority movement. So I feel like that, and I don't want to point fingers or that type of thing, but at the same time, I felt like that we need to bring back that idea of spirituality, and maybe the healing arts would be a wonderful place for that seed to start to resonate, and maybe pull it out of the political sphere. And so I like that the hospitals will engage the idea of looking at the spiritual, mental well-being of all their patients, and not just the physical well-being. It's not transactional. It's actually an art. It's a healing art. You can't, and as I think Marcos pointed out so eloquently, you can't take if you say the bottom line is money, as opposed to bottom line is a healthy society that recognizes, it takes the community to help create those wellness opportunities. So again, I guess going back to the idea of healing arts, and that the vulnerability that all of us are going to face at some point in our lives as a starting point.
Yes, the individuals we've talked to previously, the individuals we're talking to now, all spiritual leaders, eager to reach out, eager to connect, eager to understand how other spiritual communities are addressing these things. Everyone we speak with wants a copy of the report when we've completed each of the studies. They're curious to connect and to know how others are moving forward at this time. I think that speaks well for the potential of collaboration and the ability of this group of individuals to come together in important and novel ways. At least we've been really impressed with that drive on the part of the participants in both of our studies.
Alex, if I have another question, something that Charlie mentioned, the moral majority and politics. So all things are pointing to a major political shift with the recent leak of the brief decision from the Supreme Court to overturn Roe v. Wade. Are there what are you hearing from faith communities here in Indiana about the potential overturning of Roe v. Wade? And are there conversations anticipating that significant changes will come? How are other faith communities talking about this, or are they even talking about it?
Yeah, sadly, I don't. I'm not hearing a robust conversation with our faith communities about the Roe v. Wade. So, yeah, full disclosure again, as I grew up in a loving Catholic family, my mother was in the Catholic community and talked about the different spectrums within our own community. I grew up in the wing of the Catholic Church that did want to make abortion available. They wanted it safe and rare, and how could we work together to make sure that it is rare, but really see it as a conversation between a medical professional and a young person who finds himself in those circumstances. So that's just me personally. I'll just say directly to your question, unfortunately, I have not heard a robust conversation or a lot of faith communities that are eager to have that conversation. It's a topic that's been very politicized, and unfortunately, I think a lot of the medical questions have been wrestled away from the experts. I think similar in education, right? We've politicized education, and the educational experts are not in the room where a lot of these public policy decisions are being made. So I guess that's a sad statement. But how we get it back, I think that was Dr. Lyon's question. How do we gain that back and move it in a more peaceful direction?
I don't know if I have a question or a comment or what, but just the quietness and the questions, I'll tell you where I am. I think spiritually and theologically, our expertise has been taken from us too. And doing this for as many years as I've done it, for the first time to get attacked for being open to spiritual diversity had a profound impact on me. And it kind of leaves me kind of wondering what to do. I come to work because it's a safe place. We can talk because we provide care to people of a variety of faiths, and we all respect one another. But I can't say that I go into my congregation these days and feel that safe. I'm gauging what I say. And that's sad and disappointing and disheartening.
I agree with you, Vern. I often say it's easy to armchair quarterback theology until you got to go get on the field.
And if I can add to my colleagues' words, just today, for example, after I work on Tuesday mornings, I often stop off at Methodist and where there's a chat with some fellow chaplains. And we sometimes talk about theology and differences, but always with respect and love. And it's really refreshing. And it just is. But to the question that Marcos asked, I'm not going to get into the politics of Roe v. Wade, but from a Jewish perspective, from a Jewish perspective, life begins at birth, which is a different approach or idea. And I'm afraid, I get upset when religion creeps into law. I can say that, right? It hurts. I won't say
And yet, Bruce, at my Baptist seminary in the 70s, my ethics professor taught exactly that. So, yeah.
And that has had an impact where Jewish women sometimes want to give birth. And we mentioned this at the Jewish meeting, you know, if the mother's life is in danger, what will happen? And it all goes down to when do you begin life begin? When do you believe life begins? But I'm getting too far close to politics now, so I apologize.
I think if anything, the feeling of some of the space with this conversation just shows that there's the stress and that there's there are feelings to be felt. As we are getting close to the end of our time, one thing I would say to speak into that is some of the radiation from that seed I see is the next generation. I see that in the medical students that are really hungry to have conversations about how to take care of somebody from a different spiritual background than their own. And I also see it in my children. And, you know, when I talk to my 10-year-old about what it was like to learn Hebrew from Rabbi Bruce on an airplane, or what it was like to visit the Mojid. And tonight, you know, I'll share, I got to host this conversation about religious diversity with these two amazing people who are doing this work in research and in the community. And so I think that's also hope to remember. There's this old song that goes something like, it's sort of a negative song. It goes, be careful, little ears, what you hear. But I think the reverse is true, that we don't realize that the hope we're instilling in young ears by the work we're doing. And so I wanted to leave that as my last words, to thank Charlie and Ann for the work you're doing, and please keep it up.
Thank you, everyone. Thank you, Dr. Lyon. Thank you, Gloria. And it's good to see my friends and colleagues on this call. So thank you very much.
Thank you all. Thank you for having us here.